Good morning. My name is Dr. Chiraag Kotecha of Acne Cosmetic Clinic and Medispa. Today we're going to be talking about acne vulgaris and a few other topics. Acne is a very common condition. I get a lot of patients coming to see me with acne, with pimples, and it obviously disfigures them. They're worried about their look, about the black marks they develop on the face. So let's start off with the basics of the acne. Then we'll talk about who is prone to it, treatment options, and what you should be doing for it. So, in simple terms, and I will read this out, what is acne? Acne is a chronic inflammation, i.e. swelling, of your pilosebaceous units. These are the sweat ducts, where you get excess sebum or oil being produced that leads to what we call comedones, which you might refer to as open and closed or black and white heads. You also develop some cysts and scars. These ducts that develop this excess sebum are then colonized or invaded by bacteria. The bacteria in particular is called Propionibacterium acnes, which then release inflammatory things to cause more swelling. And this usually affects the face, the shoulders, the back, upper chest. And this then results in what we call acne. So what type of skin is prone to acne? Well, men and women all are affected, although women tend to be affected earlier on. The peak age is 18 years old. When somebody turns about 12, when the hormonal changes happen, teenage time, this all results in inflammation. And then it goes into the 20s, it persists into the 20s, although in women it can even go for a bit longer. It does not differentiate from race. So if you're dark skinned, African skinned, or white or brown, it all affects all of us equally, so there is no racial variation. In adults, you do see some acne coming on later on. Somebody who's never had acne as a teenager or as a young adult, but it can happen later on in life. And this is most often in our practice here in Uganda. We see it happening due to cosmetic-induced acne, especially in middle-aged women. We use a variety of cosmetics out in the market, and drug-induced. Sometimes people develop medical conditions that require things like steroids. This can also result in acne. At this point, I would like to say that sometimes these middle-aged women, when they develop acne, they'll go to the pharmacy or they'll go to any skin shop and say, oh, I've got these pimples, and they'll start treating it with steroids again, with creams. Initially, yes, it does help, it looks better, but then you get really bad rebound acne. So my advice is go see the doctor, whoever it is, for treatment earlier on. Natural remedies. People come and say, oh, I tried a lot of natural remedies, but it's still not helping. The main thing is to clean and wash that face where the ducts are clogged with the sebum or the oil. Moisturize regularly and use sunscreen. Now sunscreen, there are many types available, but you need to find something that says that it's non-comedogenic. So you should cleanse your makeup off at night thoroughly, and in our environment, if you're using the boda or whatever, go to your destination, clean your face, especially at around lunchtime, and apply your sunscreen or your moisturizer again. Back to what we talked about, the dangers of self-medication. It is always better. Please, it is always better to treat earlier on. Don't think it will go away, that it takes its time. It does get worse. People, like I said, will say, oh, it'll go away, especially their parents will tell their teenagers, oh, don't worry, this is just part of your time, your teenage life. But they don't realize the scarring and the problem that can happen from the acne is actually a lot more difficult and more persistent, and can lead to reduced self-esteem and morale later in life. So come treat early. Initial management. When we talk about the treatment, initial management includes topical products. We use things like benzoyl peroxide, salicylic acid, tretinoin cream, chemical peels, and so on. Now, again, some of these are available in the pharmacy, but do not self-medicate, because if not used properly, then it is really not going to help you. We also use antibiotics for mild to moderate acne, and if it's severe and untreated, well, it can result in scarring. It's more problematic, especially in African skin, where you get the hyperpigmentation of the black marks on the face. So again, do not go to the pharmacy and buy the steroids. I see it a lot, but it damages the skin. On that note, recently I actually the last 2 weeks, I've seen a lot of clients with acne problems coming and saying that, oh, I've been taking a medication called Acne, isotretinoin, which is widely available. Now, this is what we classify a class A teratogen. It has a 99% chance of causing birth defects in the unborn child, so there are good precautions to take. Pregnancy should be avoided for even 1 year after you're on that treatment. So don't take that tablet haphazardly. A pharmacist will give it to you. Do not follow that. It may be the correct treatment for you for severe acne. However, it needs to be under the medical guidance, because we also need to monitor your liver and your cholesterol, because that can damage that also. So do not self-medicate. Now, acne treatment, another thing I get people saying, it requires patience. Initially, when you start the treatment, your skin gets a bit worse before it gets better. You aim for 3 to 6 months of treatment. Again, not one product or one treatment will be suitable for all. We have to go through stepwise ladder. We add and remove things as the treatment progresses. We at Avane have also introduced LED phototherapy for this. LED light helps kill that propionibacterium acnes on the skin. So it takes time, be patient. It can be expensive, especially if you've not had it treated for a long time. Treatment earlier on, when it's mild to moderate, is cheaper than if you wait for it to become more severe. So when you look at the costs over time, it's a stepwise treatment. You'll pay a little bit here and there, but it is better to do that than to have a lifelong scarred face or disfigurement. So that is on acne. If anytime you want to talk a bit more, you're more than welcome. Go see a doctor or come to Avane here at Forest Mall, Lugogo Bypass, and we can help you through it. You can come and consult and not obligated to have any treatment done. We can guide you through your creams and products you may have already bought, because by the time most people attend to a doctor, they already have tried many things over the counter. Some of the things which may work, some may not. However, we need to help you through the correct routine, regime of getting that acne better. So, if you have acne and want to get the treatment, please do come see me. My name is Dr. Chiraag Kotecha. I am the lead specialist at Avane Cosmetic Clinic and Medispa here at Forest Mall, Lugogo Bypass. Thank you.